Eduardo Sanchez, the Chief Medical Officer for Prevention at the American Heart Association. Today, I'm so honored to be joined by Dr. Jennifer Mieres, Senior Vice President for the Center for Equity of Care and Chief Diversity and Inclusion Officer at Northwell Health. Jennifer is also a longtime volunteer with the American Heart Association. Jennifer, thank you for being an accomplished thought leader, for your passionate voice for equity in healthcare. And I've got to say, thank you for all you've done for the American Heart Association. Please share with our viewers what healthcare equity means for healthcare professionals and for patients.
We are at a landmark moment in healthcare where it is time for healthcare redesign. And as we look at it, and I know the American Heart Association has been a leader in healthcare redesign, in integrating the components of equity and inclusion and diversity in our healthcare redesign, that all of us have a role to play. So I think cultural beliefs, their beliefs about healthcare, their language, how we communicate, and do they understand what the treatment plan is, access to healthcare, access to medication, all of these factors known as the determinants of health play a role. And so for us to truly redesign healthcare, to have an equity lens and improve health outcomes, we need to integrate all of the determinants of health so that we meet our patients where they are. And for example, someone who works the night shift may not have access to be able to exercise. And so if we are to adopt the framework that we see our patients as partners and that healthcare is truly a team sport, so cardiovascular care, we have to integrate the determinants of health and customize care based on the needs of our individual patients to really improve health outcomes for all.
That is really, really very interesting and exciting. And what I heard there relates to the importance that as practitioners, reminding ourselves how important tone and communication are to effectively connect with our patients. Healthcare delivery is transforming, as you're talking about, and the means by which we interact with our patients is and maybe needs to evolve. How does tone and good communication impact overall care? And what's your perspective on how this will improve or implicate health outcomes and healing?
So I think that engaged and active listening and really helping to co-create the treatment plan is definitely important. So in terms of, tone, so, if you and I are communicating, in any sort of relationship, I need to know and you need to know that we trust each other and you value my opinion and I value your opinion. The same thing with the patient interaction. You're seeing your patient, you're sitting down in the healthcare team and healthcare redesign. So one, preferred language, definitely, and that goes for people that are deaf or hard of hearing, who need to communicate in sign language. We need to really expand our communication platform and formalize it so we can effectively have shared decision making with our patients.
I found that with my patients, the preferred language was simple, understandable, to the point, and actionable. And I think that much of what you've said lines up with that. I am, again, so grateful on behalf of the American Heart Association for all that you've done to support not only AHA as an organization, but our mission, which, as you may or may not know, to be a relentless force for a world of longer, healthier lives, has now been complemented by the American Heart Association's commitment to be champions for health equity. Many of the insights that we've discussed today are also covered in a recent book that you've written and published with your colleagues titled Reigniting the Human Connection, The Pathway to Diversity, Inclusion, and Health Equity. Jennifer Mieres, thank you so very much.
Thank you so very much. Truly a pleasure. And congratulations to the AHA on the amazing work, always leading in science and changing healthcare for us all. So, a pleasure being here.